is a team of 6 certified community health workers who go out into the community and do work with our patients and community members.
We are individuals in this community who want to lift up other individuals in this community.
So for Connections specifically, I think one of the most successful parts of that program is that we've been able to keep 6 certified people fully staffed and really make an impact in our community. We now have people in all different specialties, including doula, peer wellness specialist, certified interpreters, certified organ health plan assisters. We have so many different things that we can offer, and I love that Connections can be that one hub where if somebody doesn't know what they need or what provider they should call or something like that, there's one number here in Good Shepherd where they can call that we will give unbiased information to them, saying here are some resources for you, whether it's Good Shepherd or not, here's what our community can offer you, and here's how we can help.
So if you are needing a car seat, helmet, life vest, we can provide those resources for you, medical transportation, things like that. But we also connect you to those resources in our community. So if you're needing housing, a new PCP, we don't just give you a phone number and say, okay, be on your way. We will connect you with those resources and make sure to assist you in making an appointment if you would like to do so, and also make sure that you have a way to get there. And if you're needing a reminder or you're just needing someone to come advocate for you, I also provide that service. So Hermiston is in rural Eastern Oregon. We have hot summers and cold winters because we are a high desert. We're known for our watermelons, so if you ever come to this area, highly recommend having some watermelons.
We are growing quite rapidly, and our needs are catching up with us for that. Hermiston still has the rural community feel, but we are now becoming larger with the amount of things we can offer, especially healthcare services.
We really do have to have multiple titles to be able to cover the needs of our environment. So myself, I am a community health worker and peer wellness specialist, so I can put on that mental health cap and be able to open the door to walk alongside individuals in a non-judgmental way. So if you are unhoused, if you are battling an addiction, if you are just having some extra anxiety, these are all places where I can fill in. Currently, I do a mental health group, a teen mental health group at our local high school. We will be expanding that to 2 high schools next year, which is amazing. We would like that to grow and continue. We do have some other undersourced schools in our area that could really benefit from having a mental health group. So we're just looking to expand that and really tap into those areas where our individuals are not being met.
Our team has a great sense of pride in what they do. We are able to help the community in so many different ways that a lot of people aren't even aware of, with the social determinants of health and housing and food and all of these things that impact our overall health, right? So Good Shepherd Healthcare System is not only a hub for your healthcare and your specialties, but we can also help with all these other things.
Sometimes some of these people live not very close to the hospital and they don't have the means to get there, and this is an excellent service to make that available to them. And we enjoy doing it for them, okay? It's, I don't know, I think I kind of enjoy serving.
Our programs are here to help the community get where they need to be with their services. Even though we're not able to provide all the direct services, we will help find where you need to be and be a great starting point for patients to find those services that they need.
When people are wanting to make changes in their life and they are making those changes, it's wonderful to celebrate with them. And you know, I kind of always feel like, oh, you always have the strength, like I know you can do it, but it's really amazing to watch them meet those goals on their own just by having someone who can reassure them, or that can really that non-judgmental piece and really is open and there for them.
My name is Jerry Bray. I'm from California originally.
I come from Oregon, and we met in college at Pepperdine. He's from LA. Went to school here in Bandon, high school, my first public school experience, and liked it. My mother was a teacher. It's an artistic community. It's an older community, and it has a fantastic hospital.
The primary mission of our hospital in Bandon is to serve the needs, the healthcare needs of the local citizens.
I'm an LPN. I work as the unit secretary and ED clerk in the emergency department. Well, the fact that we're a small community, we have people coming back. They come back and they come back to us because they trust us.
You just feel like you're being taken care of. And I think with that feeling, with that confidence, you do get better.
The story of Jerry and June is very personal for me, actually, because when Jerry ended up as a patient in our hospital, it became a family situation.
He fell at 5 a.m. in the morning. I heard this big clang and he called my name. So I went in and he was laying on the floor in a pool of blood.
And I cracked my head on the marble floor.
And we rushed to the emergency room here in Bandon. Thank goodness we had one, or he would have died if we didn't have one.
The family was in crisis, June was in crisis, and it's very personal for me because my wife jumped in and became a part of the infrastructure and the family support that day.
In bigger places like that, a lot of times people are just going there with big emergencies and you never see them again. Here we have an image to hold up.
It all started with our strategic plan. We made it a community-wide transparent process because we're a public hospital, but also because we wanted input from our stakeholders, the medical staff, our community clinic partners, Chamber of Commerce, all part of that process. So we've embodied that through a series of programs that are designed to enhance the patient experience at our facility. One of the things that we've done is we've initiated callbacks so that our emergency department nurses are calling back patients a day after their experience in the hospital and finding out how it went.
I feel that it's important because a lot of people end up calling back 2 days later with questions that we can't answer. So if you call back the next day, they tend to ask questions then, and then you can answer their questions a little bit better. Make sure they have their prescriptions, if it got sent to the correct place, and then you can send it if it didn't.
But we've initiated other programs as well. We do a program here called Leadership Rounding. And with Leadership Rounding, one of our executive team, and I do it once or twice a month, goes out onto the floor and meets with our patients and asks them a series of questions.
It's essential. We have a great doctor, great neighbors. Who could want more? And like I say, it's beautiful.
We have made so much progress in the last 18 months in terms of changing the culture, bringing in people that believe in what we're doing, and making the extra effort to make our patients feel comfortable as well.
The older you get, the more essential it gets. Very important. Couldn't do without it. If we didn't have the hospital here, we'd have to move on.
I'm feeling fine for my age. I have always been very active, and I miss that. But you have to live with what you got.
You know, Jerry is a very proud man, and he is the type of person that I look up to as a professional who has grown a fabulous home and reputation in this community. And I'm so happy that we've been able to help, as a facility, help him to remain at home and remain in the home that he loves. He and his wife June, they love that home. They want to stay here forever. And because we have a nice hospital that provides excellent care services, we've been able to help Jerry and June.
I think this is the best situation we could have. We've got the best administration right now. You can really see the improvement over time. And I've never had a complaint before, but it's really exceptional now.
There is some similarity between the symbol for this area, which is a lighthouse and which we utilize in our logo. You know, the lighthouse was a safe haven for ships passing in the night, where they could feel assured that when they saw that light, they knew that they were safe. And so I see us as a facility being a place where when people come, they know that they're going to be safe, and they know they're going to be taken care of, and they know that the people that are here to take care of them are well-trained, excellent physicians that all have the same goal in mind, which is to help improve their health and help them achieve all of their health goals for the future.